Right. Looks like I'm not quite there yet. I was asked to speak about adolescents and young adults as a population of special interest. And we can get that first slide up. So, especially with sexual health and reproductive rights, there are a number of issues around adolescents and young adults that are worth a brief highlight. Let's take young men who have sex with men. So we know that there is a family and peer context which very often involves rejection and stigma. It's hard to overstate the stress of a young gay man or transgender woman in the family context, because it is poorly understood by parents typically, or guardians, and next slide. And often the natural love that might come from a parent is distorted into disciplining the child into not being gay. And as a pediatrician working with adolescents, time and time again, I would remind parents simply to love their child, and to love their child as the child is, and to learn more about the child's sexual preference, this sort of nurturing environment. And we have study after study demonstrating that the more acceptance that a gay child has in the household, the lower the HIV risk, the lower the STI risk, the lower the mental health disturbance risk is. But still, the norm is very often rejection and stigma. That's the context in which you're doing research in these young people. So that's what you have to keep in mind. There has to be enhanced standard of care. Standard of care won't be good enough. There are legal issues. The concept of a liberated minor, where a child is living away from the home, but is still a minor, or is sexually active, but is still a minor. Some legal settings consider that a liberated minor. You can care for that child without parental input. But other settings don't consider that. And strictly speaking, from a legal point of view, you might be forced essentially, legally, to engage a parent or guardian. Sometimes that parent or guardian is welcome by the child, but sometimes it's not welcome. Particularly a parent or guardian who's been punitive or abusive. There may be same-sex prohibitions in societies where male-to-male sex is illegal, and this may affect a child. Keep in mind the mental health and vulnerability elements. There may be housing and food vulnerability. There may be sexual exploitation, which is part of the child's experience. And there may be a loss of self-esteem and depression, including the risk of self-harm. So when we do this research, we must keep these elements in mind. Now let's shift a little bit to adolescent girls and young women. Again, consider family and peers. There are societal expectations which may include early marriage. In some societies, a 13-year-old is commonly married off, and might maybe be married off in an arranged marriage to a 35-year-old. So what we would consider child abuse may be a norm in some societies. Female genital mutilation is quite extensive in parts of Africa, and may be a factor in our engagement with young women. Again, legal issues of liberated minor, but access to reproductive health services, independent of parents' knowledge or engagement, is variable in different societies. In some settings, that's illegal. In other settings, it's allowed. And in all settings, one would think it's ethical to provide these protective services to youth, and you may be up against conflict with the local laws. Again, mental health and vulnerability, Again, housing and food vulnerability, sexual exploitation, self-esteem and depression, risk of self-harm. That can apply to MSM, that can apply to young women. Now, before one commences research in adolescence, you obviously want high-quality scientific and ethical research with clear research objectives and priorities. It should be crystal clear why you're doing this work in adolescence. If you don't have that clear, why should we support that work? Engaging communities can include adolescent advocates, people who are very knowledgeable about local circumstances. Can include sexual minority advocates, people who are sensitive to youth who are having sex with men, who are having sex, boys having sex with men, or boys having sex with other boys. Ensuring local capacity and community partnerships is essential, and addressing all the ethical issues in study design, issues of vulnerability, role of parents and guardians, consent, assent, permission, re-consent, all of these must be addressed within the context of ethical review of research. Now, I'm just going to present some references. You don't have to write this down. These slides are available to you. I just wanted you to have them in case you're doing any work in adolescence. Some of these might come in handy for you. So there's an interesting book that's free online through UNESCO, and by Deverstein, Women's Rights and Bioethics, and the chapter by Cook and Praetorius is quite good, Duties to Implement Protective Rights in the Case of Adolescence. So I would commend that chapter to you, readily available online. I'll show you UN documents in the next slides, and also I'll show you an HPTN guidance document, HIV Prevention Trials Network guidance document. And here are just some references. It starts on this page, it goes here, and it goes there. Some of them are worthy of highlighting. For example, this last one, Melgar et al., Assessment of Country Policies Affecting Reproductive Health for Adolescents in the Philippines. So there, someone has tackled the exact circumstances in the Philippines as assessed country policies that affect reproductive health. That sounds like a really good article to be written for Malaysia. That would be amazing to see such an article. And there are a number of journals that would take a very strong interest in such an article. That's why I highlighted it. And here are other references. Here are other references. I didn't intend for you to write them down. They're simply available to you. And they're all from the adolescent ethics research HIV literature. They're not necessarily HIV, included some others. Now these are two documents from UNAIDS. One is a partnership with WHO, the other one with AVAC, and one is on ethical considerations in biomedical HIV prevention trials. It was updated just in 2021, so it's hot off the presses. And then the good participatory practice guidelines for biomedical HIV prevention trials. Now these may look the same, but they're not. One is ethical considerations, the other is participatory practice. How can you engage? And I think the adolescent agenda is especially important when one considers these documents. Very, very important for all research, I would say. And then this is the HIV Prevention Trials Network Ethics Guidance for Research. A good friend of Malaysia, Jeremy Sugarman, was instrumental in crafting this document. And we've just updated it in the HPTN in 2020. And this is available online. The format of the HPTN document, there are 15 guidance points, and some are essentially morally required and others are for your consideration. And each point identifies the people responsible for addressing the point. So it's almost a practical guide to how to launch HIV prevention research in low and middle income countries. I participated in 3 WHO consultations that were led by Manjula Narasimhan, who is at the WHO and spearheading a lot of adolescent HIV, sexual and reproductive health and rights work. And these are just short editorials summarizing meeting reports that might be of some interest to you. So keep in mind that adolescents and young adults are sometimes at very high risk of HIV acquisition. Think about South Africa, where the highest incidence rates are in adolescent minor girls. And think about young gay men and some of their incidence rates in Asia. So they may be at high risk or even highest risk. So try not to exclude them from your research. We need insights that apply to adolescents. On the other hand, they have among the highest vulnerabilities. They're children, right? And don't do research thoughtlessly. Thank you.